Tinnitus has many causes, but what I want to discuss here today is tinnitus is a part of Meniere's disease. We must understand that the inner ear has two parts, the cochlea, which is responsible for hearing, and the labyrinth and the vestibule, which is responsible for equilibrium. Now, Meniere's disease typically has a triad of symptoms: fluctuating hearing loss, tinnitus, and vertigo. But it is not always this triad which is presented by patients. There is a part of Meniere's disease in which, in the early stages, when we say the prodromal stage, it may just come as either imbalance or dizziness, or maybe the cochlear component of the disease with tinnitus. So we have to pick up this disease at that stage, at the prodromal stage. Later on, it may become even, to start with, it may be unilateral, that means it may start on one side, but later on, it may even become bilateral, and usually it becomes a bilateral disorder. It is very important that we pick up this disease during that prodromal stage, which generally remains for the first year of the disease, in the first year of the disease. It is this period when it is very important that we understand that it may not be just an idiopathic tinnitus because of some other reasons which is known, like drug-induced or noise-induced or head injury-induced, whatever. But we have to really make out whether that first attack of Meniere's can or is presenting like tinnitus. There are different ways of diagnosing this, and one of this is audiometry. We do an audiometry. We might find some hearing loss, maybe in the lower frequencies, in the higher frequencies, or in the middle frequencies. But there is another very important test during this stage, which we called the SISI, the Short Increment Sensitivity Index, the SISI, which needs to be done, which actually tells us the recruitment in the inner ear, and this may indicate towards an onset of Meniere's disease in the later period of time. The causes of Meniere's are very many, and particularly in the present era: high salt intake, high stress levels, hereditary, high estrogen levels, particularly during pregnancy and later in the menopausal age, but it can also occur in men because estrogens are there in men also. This hormone is there in men also. So it is very important that these causes are identified or seen. Apart from this, one very important other thing may be autoimmune disorder, and we have different tests today to rule out autoimmune disorder and to see whether other organs in the body are also affected by this autoimmune disorder. And if they are, then the diagnosis of Meniere's can be established better than with just as alone tinnitus coming. The treatment for Meniere's is, first of all, prevention of these causative agents, like the salt intake has to be reduced, the stress levels have to be reduced, it has to be seen whether the person has autoimmune disorder by doing blood test and other test and other examination, and that should also be taken into account. Other than that, piracetam is a good drug which increases the blood circulation to the inner ear. Acetazolamide is another drug which reduces the fluid content of the endolymphatic space, which actually has gone high in these cases. And last but not the least, intratympanic decadron. Now this has a very important role to play, because we think that the allergic or autoimmune debris gets blocks the endolymphatic duct, the duct which takes the endolymph from the endolymphatic system into the sac, which is placed extradural and intracranial. So there we have to see whether this debris is blocking this duct, and by giving intratympanic decadron, not only does it take care of the allergic component, it is also anti-inflammatory and takes care of this debris which is lying in the endolymphatic duct, and has a very good response as far as the vertigo and the hearing loss and even the tinnitus is concerned. Yes, sometimes 10 to 20% of the cases, if it is a chronic case, the tinnitus may not come down, but the vertigo and the hearing loss may improve definitely. The vertigo definitely improves. The hearing loss may or may not improve. The tinnitus also improves about 70 to 80% of the times if in the diagnosed and treated in the early stages in period of time. If not, then tinnitus has the way we treat the other cases, we treat tinnitus that way. Thank you.